Hi, good evening, everyone. My name is Bartosz and I wanted to say something about, we've got a topic about, thyroid problems and autoimmunity. And I wanted to talk a bit about what autoimmunity is, because it is very common these days. You're going to hear it a lot, not only for thyroid problems, but we've got a lot of other conditions which share the same autoimmune background. So then I thought might be worth knowing a little bit more about how it works and where is it coming from. So maybe I start with, if we try to position where autoimmunity is on the scale between healthy person and a very unhealthy person. So if we take a healthy person, obviously no problems, no disease, no dramas. And as we take as an example of unhealthy person, we can take somebody with advanced cancer. Then there would be quite a lot of things which is out of order, very complex issues, and well, a lot of work. And next after health, I think, what would be worth mentioning is allergies, something when somebody's developed allergies, because what we have here is immune system is overreacting to the stimuli. So if we're gonna have pet allergies, fur, pollen, chemical allergies, the body is, something is not exactly right, an immune system producing unproportional reaction to the stimuli. The next after this, I think, would be our autoimmune state, when immune system, which is part of the body, attacks its own component. So immune system attacking other parts of the body. And this is what we're gonna have in Hashimoto, in thyroid problems. We're gonna have this in, for example, IBS, we're gonna have in rheumatoid arthritis, we're gonna have it in MS, we're gonna have it in, for example, Alzheimer. So this autoimmune engine is common for a lot of, common these days, 21st century conditions. And, the next stage would be cancerous processes, when a part of the body actually started, went into the, dark side, started living its own life, doesn't respond to the body, that doesn't recognize itself as a part of the body, started living its own life, and is fighting immune system, is trying to take over control. Now, so this is our scale. The next thing is, if you ever looked, if you ever looked in Materia Medica, when we've got homeopaths looking up the remedies, you're going to have a whole bunch of different symptoms. We're talking about mental symptoms, emotional symptoms, physical symptoms. You're going to find what that person, how that person feels, what they want to eat, how they respond to the temperature, thousand different lines, and this is called what we called remedy picture. Now, this is what homeopaths use. Now, Western science, medical science, in recent years came up with the concept of psychoneuroendocrinoimmunology. Okay, this is basically fairly new idea, when the scientists noticed that yes, these are independent. We have established kind of that these are independent systems, nervous system that this, endocrine system that this, immune system that this. But what they've noticed that they are working very closely with, and they communicate with themselves, that it's rather better for us to consider them different facets of something which would make me, rather than independent systems. And when this communication is broken, this is when disease or the process of some disharmony starts. And now, if we, psychoneuroendocrinoimmunology, so first component is our psychology or our state of mind. And now, if you ever come across psychology, in Jungian psychology, very important aspect is shadow or suppression. So everything which we reject, which we don't like, everything is dismissed, okay? Everything which we cannot handle, everything goes under the carpet, everything goes into a bag, and we believe that as soon as it disappeared, everything is fine and we're going to be okay. It is not, because sooner or later, those suppressed things will come back stronger and they're going to start causing problems. So this is why I'm talking about this, because Kira will tell you a little bit more about how trauma, emotional trauma, undealt with, can produce the role of an emotional trauma in development of thyroid problems. So then just bear this in mind, you're going to hear slightly more about this. Now, what is needed, you know, if we have a person, healthy person, you see what is needed actually to develop this, to get into this, you know, autoimmune state. So there would be some definitely triggers, some environmental factors. There would be a bit of genetics, okay, or genetics, epigenetics. There would be a huge role of your microbiome, your total bacterial flora of your body. And by the way, I think we've got the ratio is about 1 to 10. So we've got 10 more bacteria versus our own cells. So we've got more bacteria in the body than our own cells. So the role of a microbiome is huge if we look at our immunity, overall health, 1,000 different things, and also very, very important in thyroid problems. And if those things would be affected, this will lead inevitably to activation of immune system, which is going to start attacking your own body cells. And in this case, there's going to be thyroid cells. There's going to be some inflammation, and there's going to be 1,000 other things. Now, if we're going to, you know, we're going to go back to the first element, the environmental factors. Now, what can it be in aspect of, you know, thyroid problems? It can be, number one, trauma, emotional trauma. Now, it also can be chemical poisoning, okay? It can be, for example, certain additives, chemicals, which we use, okay, glyphosate, for example. It can be infection. It can be viral infection, can be bacterial infection, Epstein-Barr virus, hepatitis C, Helicobacter pylori. This is all, you know, what you're going to come across, you know, as a separate entity, but that infection can be actually a trigger for much more complex problems. Then next thing's genetics and epigenetics. Your genome, your genes, which you have inherited from your parents, it is basically an information which makes you. Now, it isn't just information. Now, if this information is used incorrectly, it can produce some problems. And epigenetics is a branch of science which basically investigates how environmental factors can change expression of the genes and can or keep you in health or can lead you into, you know, some problem and disease. And again, this is concept not so strange for homeopaths, because if you ever had a consultation with homeopath, you probably remember that we're gonna have to ask you about your family history. So then how were your parents, how were your grandparents, what bothered them, what kind of problems they had, because we are trying to establish what have you inherited. So then we're trying to establish that where you are, and for example, if you come across any of the triggering points, which way you gonna develop. So for example, if there was a lot of cardiovascular problems, strokes, heart attacks, and so on in both sides of the family, then more likely I'm gonna follow the same, unlikely I'm gonna have something else. And this is a homeopathic take on epigenetics, basically. Now, when we've got this trigger which changes your genetics, then obviously changes in microbiome gonna follow. So then composition and constitution of your gastrointestinal flora will change. And Under normal circumstances, each part of digestive tract has got specific parameters. So for example, your stomach is almost sterile. There's almost zero bacteria that have a specific acidity, and this is how it should be. Then further down your digestive tracts, the amount of bacteria grows, and they are doing very, very important job, because, for example, in aspect of thyroid, bacteria living in your gut are responsible for uptake certain micronutrients which are necessary for production of thyroid hormones. So we're talking about iodine, we're talking about iron and selenium. So then if that flora is disturbed, you've got much, much less chance to actually absorb nutrients and produce hormones which you need. There are quite few research showing impact of the flora of thyroid condition. When using right composition probiotics, you can actually stabilize thyroid function. Okay, so then it is very clear link. If you're gonna work on your gut flora, your thyroid will improve. Now, this composition of the flora would be also very specific for the stage or form of the thyroid problem you might be experiencing. Graves' disease gonna have a different composition than Hashimoto. Now, beginning of the scale of Hashimoto will have also different flora than, for example, more advanced stages. So this is, and just to say, gut flora is a huge part of the immune system. That's why I'm talking about this, because this goes also back to autoimmunity and so on and so on. Now, so, but how is this happening in the body? How is this processing? So if we have some traumatic experience, what is happening in the body that it leads to all these cascades? Now, there is a very important and interesting part of the nervous system, which is called hypothalamus. It's a part of the brain, which is very important and interesting for at least a couple of reasons. One of this, it is a part of hypothalamus, pituitary, and thyroid axis, which basically hypothalamus controls function of thyroid gland. Also, it is part of the nervous system which secretes hormones. So this is a part of nervous system which has got double function, nervous system and hormonal system. And the third thing is that part of the body is responsible for processing certain emotions, such as happiness, rage, hypothalamus controls sexual behavior. So this is all components. Like if you look at the common theme for any traumas, you're gonna have a lot of unhappiness, you're gonna have a lot of happiness, you're gonna have a lot of abuse, and the whole bunch of strong emotions. And this is when hypothalamus has to process those emotions and translate it into hormonal system, and it directly controls thyroid gland. Now, probably another question would be, and what this got to do with homeopathy? Now, I would say only that we know how those components, psycho, neuro, and endocrine, immune system, how they communicate. Okay, there's the whole bunch of different signaling molecules which they use to talk between themselves, as I mentioned, hypothalamus, for example. Now, these, in modern days, we know what substances, what molecules these are, and we can use them in homeopathic potency. So we can use them to restore that communication with different parts of the body, and we can use it alongside of treatment. When we looking at, for example, individual treatment plans, we can address trauma directly, we can enhance that healing process, digging slightly deeper into that connections and restoring them if necessary. And this is, the branch of homeopathy, which, operates on slightly different level, but I think very important, because gives us access to certain things which we probably didn't know how to access before. And just as an example, slightly different idea, all neurodegenerative conditions, they will have autoimmune aspects. And we know that, for example, in Alzheimer, Parkinson, we're going to have disturbance in those signaling molecules, which are called neurotropins. But these molecules are important. Nervous system uses them. How to maintain nervous system? They're very important in pregnancy, when the baby's nervous system, brain is created and maintained. And for grown-ups, very important to actually keep it in shape and keep it working. So then in treatments of those conditions, we can use those signaling molecules, we can use neurotropins in homeopathic potency to actually enhance the treatment and to help with the condition. And so this is me only talking about kind of one aspect and one layer of the treatment. And I think I will pass it to Anthony now, and he will probably tell you more about what to do and how to do.
Thank you, Bart. Evening, everybody. Dr. Anthony de Pontes. I'm going to talk to you a little bit about what I call the expectations of your disease and how these expectations can affect your disease process, your healing, or even, if I can put it the other way, if it's not your healing, the disease process from being stimulated. So here we're looking at aspects of not just the physical. We're looking at how the body, or what constitutes the body. We're looking at the physical plane, the emotional plane, and the mental plane. So these expectations can move across all different planes. But I want to start this discussion like this. And I'm making assumptions here that you guys have got maybe friends or yourself who have got thyroid-related conditions, maybe Hashimoto's, or autoimmune disease, or even chronic thyroid disease. And what happens when you wake up today and it's been 5-10 years that you've had this disease for? How are you feeling? Well, you've got to get up, you've got to fight the day, you've got to make sure that your thyroid is functioning and that you are ready to go. And let me just ask it to you this way then. So what are the thoughts that might run through your mind if it was different? How would your life be different if you were able to be a more involved mom because you're not so tired, you've got more energy, or if you're less grumpy or less depressed, or you have less emotional hang-ups, or you've got less anxiety and depression, or even if you like 30 pounds lighter because you've got your condition under control. How do these expectations change your health? And if you had to look back to when you were first diagnosed, what were your thoughts on the disease? And did you believe what they told you? And now, do you believe it the same way, or has it changed? Maybe there's a lot of regret or disappointment, maybe even resentment. Are you happy living your daily life with the constraint of this health illness? See, these expectations set up a path of disease that can be positive or negative. And it can actually lead or help you to getting to the bottom of your causation for your thyroid manifestation, or it can actually inhibit you. Let's say whatever the diagnosis is that you've been given, and you believe it's incurable. Listen, I've had this for 5 years, I haven't got any better. You believe it's incurable, and that can limit your healing ability as well. So these expectations, they actually affect you a lot, and it's often on a subconscious level. You're not aware of it. You're just going across with your daily life, doing everything, and you're not realizing how much it's affecting you. So I want to give you an example of how these expectations work with another example. So you fracture your leg. Okay, it's some bad luck. I've got to go and get a cast put on, but in 6 weeks' time, I'll be up and running. That expectation is done and dusted, and you may be not too traumatized from that. Or is it that you've been diagnosed with hypertension and you have to take hypertensive drugs for the rest of your life? And maybe your expectation is, okay, well, that doesn't really affect me too much. I'll just take drugs and I'll carry on with my life. Your expectation is fine, or it's regulated, and your life will go on and there's no problem. But this generally is not the case with a systemic thyroid disease, because it affects you from all different angles. Now, I want to say this. I know the signs of thyroid disease and autoimmune thyroiditis, and probably if the patient came to see me in the beginning, we could turn that problem around 6 months, 12 months. And that's because the patient has come from the beginning. We've been able to address those causative factors. And I say this, maybe there's not so much suppression or palliation, but that's very seldom the case. They usually come, towards the end, or they come when they've exhausted their usual use of conventional medicine. So what I want to say to you is, what I want to encourage you, or even if you can just think about this, you need a paradigm shift. You know that story about what is the definition of insanity? Doing the same thing over and over again and expecting a different outcome? Well, that's what you guys have been doing. I go to the doctor, I get my labs tested, he says whatever he says, and I go on. And then I come back in a couple of months and I do it again and again and again. And why? Well, that's just what happens. Hey? I want to encourage you to make a paradigm shift. Maybe it hasn't been put across to you this way. But if you look at the medical model, and no disrespect to medical doctors in any way, but the model doesn't work. Okay? It goes with the germ theory. It goes with disease. I'm wanting you to chuck that model, leave that behind, move over to the terrain theory, move over to health and vitality. Set yourself free, allow your body to gain that vitality. So you're going to be looking at epigenetics, not genetics, where epigenetics is how your environment affects you. And epigenetics affects or controls 95% of your illnesses. It comes from your environment. And the epigenetics can make you responsive and not disempowering you in respect to, can we say, the genetics, which is maybe only 5% of the time effective and affecting you negatively in respect to illness. But we've been taught the opposite. Okay. Oh, I'm sick because my parents had that illness, so no, I've got it. Doesn't have to be that way. We need to change it. And these, if we talk more about these expectations and how they can mold these processes of your chronic thyroid disease, I just want to go back to the beginning. Let's say the beginning when you were diagnosed. You're not feeling so well. You go over, see the doctor. That's what we've been taught to do, and that's great. He checks you over and he orders a few lab tests, and you're full of faith. He's going to sort me out. Here's the issue that often happens. You are ignorantly misdiagnosed because those lab tests, 50% of the time, are not accurate. The other part of the time, they are often incorrectly interpreted, and often they don't use the right lab tests. And then he comes back to you and he might say to you that your thyroid is fine, or he might say, yes, you've got a bit of a low thyroid, but don't worry, we'll give you a T4, maybe a altroxin or a levothyroxine, and we'll establish your thyroid function and you'll be fine. So obviously you believe him and you go for the treatment. It makes sense, okay? And here's the thing. The results at best are mediocre. You're not fully stabilized. You keep going back for checkups. He says you're fine. According to the labs, you're fine, okay? But you don't feel fine. You might be emotionally depressed or cold all the time, or just continually putting on weight. Maybe you can't fall pregnant, whatever the story is, okay? Most of you have been down that road numerous of times, several blood tests later, and you still don't have insight. Okay, he might say to you, yes, your thyroid is this or your thyroid is that, but you don't have insight into why did your thyroid tank. Okay. But you faithfully go back on that pharmaceutical bandwagon, Is it because you're too busy? Is it because that's the only road that you know? Or is it maybe because you feel in control and you're familiar with that? Well, you're familiar with that until you're not, or until you don't feel in control. And then you get desperate. And that's when things change. You know, oh, can you see me? I'm struggling. I'm moving around on my chair here. I'm feeling uncomfortable. That's when things will change. And then you will maybe look to something different. Okay. Maybe it's a friend who says, wow, they've also got this thyroid problem and they've tried a new doctor or a new therapy. You know, there's this thing called homeopathy, and wow, I'm feeling so much better, or my antibodies are down. Well, am I going to dare my mind to go there? What if I get disappointed again? What if I can't get better? These are all thoughts that go around your head. Maybe you don't try it. Okay. Why? Because homeopathy looks at these causative factors. And if you remove those, you'll start to feel better. Now, this mindset that you have, that you develop, and it might be developed almost subconsciously as the months and the years go by with you and this thyroid illness that you've got. The problem is, in your mind, in your mind's eye, you might say, okay, I've got this thyroid condition, but in 3 years' time, we want to have another baby, we want to do this. And you've given yourself a certain amount of time to kick the habit, to kick the illness. And you're doing everything that you can. But here's the problem. You're doing it within the wrong model. You're doing it within the medical model. If you knew a bit about the medical model, they're not there to cure you. And I hope you don't think I'm being, what do they call it, when you're doing that theory of attacking the medical model? It's not that. Okay, you have a look at their gold standards. They're not there to cure you. They're there to keep you on a line, to keep you using the medication, okay, to keep you dependent. Remember, I said you want to look to change your paradigm. Maybe you don't know much about it. Start searching. There are definitely other roads that you can go down. So why is this so important? And why are these expectations so important? Because, and Kira will talk about it a bit later, you've got the emotional component. And then with the thyroid, it affects the hormonal aspect. And those two together have a impact on the physical. So it's very possible, if you can get these aspects cleared, or you can change the paradigm, you can resolve your thyroid problem. You have to also, for sure, it's my experience when looking at autoimmune thyroid conditions, even if you've resolved those causative issues, there's always the emotional triggers. And if they are not resolved, it will not heal completely. So I want to ask you, are you going to outsource your health to a doctor that's an expert in disease processes and takes his protocols from the pharmaceutical giants? You often might do that. You box yourself into a place where you feel safe, okay? And that's how your defense mechanism copes. So as long as you're doing something for your problem, you're getting labs, you're going for checkups, you're being proactive, everything will be fine. That's what I call the ostrich in the sand mentality, right? But here's the thing now. The day that your expectation of your treatment is trashed, or the day that your expectation is broken, that's the day your body gets a huge shock and you start manifesting symptoms. These are often the emotional symptoms we talk about. And those emotional symptoms push up symptoms that the homeopath can prescribe upon. The typical thing of the grief, the typical thing of the anger or the rage. And then you can give the homeopathic remedy, and it helps to release that out. Now, maybe you've only realized that 10 years down the line, and you've got that disappointment that you've lost 10 years of your life with this ill health. I'm encouraging you to change your paradigm. Another aspect that I want to encourage you with is often patients get discouraged when they start homeopathic treatment, because they feel they've been doing the treatment for a while and they're not getting the results that they need. They're not getting the results immediately. This often occurs if there's been past palliative treatment and suppressive treatment. And can I say to you that that's normal? The body has to process all of that stuff, okay? It's got to restore the glands, it's got to restore the metabolism. So if I use this analogy to you, I say to you, if you've got a headache, well, you're used to taking a headache tablet, and 15 minutes later, the headache is gone. Okay? It's gone, but it's not healed. After that pill wears off, the headache comes back, and then you've got to pop another pill. With homeopathy, the approach is different. We get into the root issue. So that's why it might take a bit longer to resolve that headache homeopathically. But once it's resolved, we've cleared out the liver, we've cleared the stagnation, we've cleared the hormonal imbalance, then the headache is resolved. And that's the difference using the homeopathic way. So if I can encourage you to look deeper and go and search, seek out your healing, because it's there. You're just going to find it. Change the road that you're on. The road that you've been going down, if you've been going down 5, 10 years, I'm not saying that that road is a useless road. You have learned lots of lessons on it, okay? But change gears, change the road. Find where you're going to find your healing, where you're going to get your healing. And you must know that doing this is not a walk in the park. It's not the easiest thing. It's not like a Sunday drive. It is going to be challenging, okay? You are going to be pushed to your limits, but that's where you learn. That's where you understand things differently. When that desperation comes in. I'm sick and tired of the mediocre way of my life is going. I'm sick and tired of just running on that hamster wheel. You've got to do something that might seem scary, that might seem that you're not fully in control of it. And then you're going to get the breakthrough. And now I've run out of words. I hope you got it. I hope you got the just behind what I'm trying to get across to you, that you can move out of this illness, because so often we are told, and our expectations confirm it for us. I've had this for 5 years, for 10 years. I've tried everything, and everything is most of the time just the medical model. There's so much more out there. Go and search, find it, and get healed. Thank you. Kira, would you like to
Hi, everybody.
Your presentation?
Yeah, sure. Good morning, good afternoon, and good night. I don't know where everybody is in the world, but I'd love to see more faces on the screens, but I understand people are doing stuff or in cars and whatnot. But I just want to say thank you, Bart and Anthony, for the words earlier. I know the science bit is fantastic and you are amazing at what you do. I tend to be a homeopath that loves to talk to people, to the authentic person, to try and bring out the real you and find a solution to the dis-ease that you are in at the moment. And I suppose that's why I love to talk about the emotional aspect of thyroid disease, Hashimoto's, and Graves' disease. And in fact, I myself am in remission from Graves' disease for several years. I just want to have a little bit of interaction. If anybody can I just ask how many here on the call are using or have been using homeopathic remedies for your thyroid? Just give me the thumbs up or a little emoji or something. Okay. I know a lot of people haven't got screens on. That is super to see, and I'm sure for others that I can't see, you're just possibly starting out on the journey, and we don't want to bombard you too much. So that's why I know some of you were looking for solutions today and remedies, but it is such a mammoth subject, and every person needs and deserves that individualized treatment. So what's going to work for me is not going to work for Helen or Michelle or whatever. I just wanted to start off with the actual thyroid itself. Obviously, Bart and Anthony have alluded to this a lot. The actual gland itself, it's in the shape of a butterfly. If you see behind me, I have my lovely little print here with butterflies. It's also known as the throat chakra, and I suppose the throat chakra is connected to your ability to communicate and speak your inner truth. And I think in a homeopathic consultation, that's where the magic happens. When we can find out who the real you is, warts and all, where, as Anthony said, you can feel the discomfort and the shift changing, that's always a sign that we've kind of hit the jackpot to a certain degree emotionally. I know I'm going to talk about kind of emotions, social isolation and breakdown of relationships as well. And the first relationship I want to talk about is the relationship with yourself. I mean, if you had a friend beside you who felt like you did, what would you do? If it was me, I'd acknowledge it, I'd recognize it, I'd try and listen without judgment, and I'd seek help, or I'd encourage my friend to seek help. And I think we owe it to ourselves. If we are going around on that eternal treadmill, and nothing is changing with the treatment that you're getting from the medics, maybe it is time to look elsewhere. And I think, just to reiterate the point, all the remedies and supplements in the world can't get you back to health until you deal with the maintaining cause. So in my practice, I would often see people who have tried so many remedies or supplements or treatments to heal and to deal with their thyroid ill health, and nothing is changing. And why is that? It could be because we're not ready to acknowledge the deep, deep traumas, the deep griefs, the issues that we've been suppressing for so long. And I mean, for various people, it can be suppression of yourself. Who am I? And I think the inability to communicate who you are is so important in recognizing when, you know, looking at your thyroid health. Things like grief, divorce, low self-esteem, trauma. I'd be curious to see how many people here who are living with thyroid disease, have you got that kind of constant who am I thought stuck in your head? Is this cyclical thing of, I used to be a happy, vibrant, energetic person, I can't change, I'm stuck. And it's a very isolating feeling, it's a very lonely feeling. And these feelings really do matter when we're discussing homeopathy. I'm not going to kind of go on too much about the emotional and things, because I think sometimes it's hard to, you want kind of realistic and practical case studies, for want of a better word. I just wanted to give you one example of a case that I had last year with a lady, and it's very common. A lady, female in the 40s, recently diagnosed with hypothyroidism and Hashimoto's. She came to me with severe anger issues, huge anger issues, bad PMS, very, very tearful, very oversensitive to her children, oversensitive to her husband, huge issues in her relationship. And it has that kind of ripple effect where everybody is really, really affected by this person's illness. So in homeopathic terms, to me, it was quite obvious that she needed sepia, or a remedy to balance her hormones. A pretty standard classic remedy. But there was something niggling at me that she was very closed, just a very closed, shut down person. So I gave her the sepia, and I also gave her Natrum muriaticum, which I'm sure some of you have heard. She came back to me a few weeks later. Life was much better, much more harmonious. The anger had gone, her hormones had settled, great relationship with her children, but her thyroid hadn't, the symptoms hadn't changed. She was still tired, overweight, a lot of issues going on, constipation, etc., etc. I left things settle for her. A few weeks later, she came back and she had been triggered by a situation of abuse that had gone on in her circle of friends. It had just triggered a memory in her that brought back huge shame, huge paralysis of her emotional self. And she got very, very sick, very, very ill. I gave her a remedy called Budalia. I can never pronounce it, but it fit for me in that huge place of shame that she was. She really resonated with the remedy, and she repeated it a few times. And I spoke to her only a few weeks ago, and she is in a hugely different place. She's very, very relaxed, very happy, and her bloods are good, which is, you know, the measure that she wants to use. But physically, she's well. And I suppose it's going back to that layer of the onions. When she came to me, anger was there. So it wasn't suppressed, but we needed to kind of push that anger, peel that anger of a layer of anger away. Then there was the kind of sadness and the kind of sitting with that. And then something triggered her trauma, which may not have been triggered had she not had the remedies. That's just a kind of a practical example of how the emotional aspect of things can really affect the thyroid. I'm conscious of time, Michelle, because we're nearly an hour here and there's probably questions and answers. But another thing I wanted to say is I'm not sure how many people here are supporting loved ones with thyroid disease, because that can be very, very lonely and isolating as well. And if you are, just know that the best thing you can do is be an active listener and look after yourself as well. So I'm actually going to leave it there because I said my passion with homeopathy is very much about finding your authentic self, looking for the clues to find where life has really caused you challenges that you just can't speak about. And in a homeopathic consultation, what we all strive to do is give you a place of respect, a place where you can feel safe, a place where you're not feeling vulnerable, to really, really express who you are and unblock that kind of gland, the throat chakra. And once the emotional kind of wheel starts turning, then it'll filter down into the physical self as well. So yeah, I look forward to any questions you might have, and I will leave it there because I know everybody's lives are very busy. So I will hand you back to Michelle and Bart and Anthony to take the floor, and I'm happy to answer any questions that you have as well.
I'd like to make a comment there. You know, actually, I see in my patients, maybe 70% of the time, it's always an emotional trigger. They might not have thyroid condition, but there's an emotion that comes up. Like you said, in your case, there was the anger. And if you are able to help them to get rid of that or process that, then it moves on down into the physical and you can deal with those physical issues. But that seems to be a trend. And that's actually what every good homeopath is like wanting to see. Because that's like you can pat yourself on the shoulder and say, hey, I'm doing a good job, because that is the way that healing occurs, from the inside out, from all those suppressed aspects going down into the physical. So that was a great example. And whenever you've got a difficult case, I have a tendency always to go and dig out the emotional things. And as you said, people have got those, they can be carrying them for years, and they're not just wanting to talk about them willy-nilly. And then the homeopathic remedy, it's almost like a domino effect. It starts to push it out, and they are able to identify the emotion, and then the remedy helps them to release it.
Yeah. Thank you, Anthony, for that.
That is really how healing can start to occur. You know, like you said, she didn't, her labs weren't changing. until you had some movement on that emotional level. And that is really the crux, specifically with thyroid conditions. It's what you need to see. And I see so often, especially in long-term cases, is they are so stubborn because that emotion is so sore that they just want to bury it as far away as possible.
Yeah. And I just want to say one other thing, and it's just for anybody who wants to progress their journey. What I see with people coming to me, and when I also choose my homeopath, I think it's really, really important that you resonate with a homeopath. Like, you know, I'm always amazed at people who change homeopaths occasionally because they're not getting results, and it can be literally around the art of case taking. You might sit in front of somebody and just not be able to release the real you. You'll go to somebody else and you'll just, it's like that aha moment of sitting in the chair and going, okay, now I think I can say what I really want to say without feeling anxious or judged or whatever. So I know Bart's fantastic website's called The Art of Homeopathy, and it's an art for so many reasons. It's an art of just taking a step back and seeing what piece of that puzzle is missing, what piece of the jigsaw needs to be just put in there to really get that person to be the best person that they can be, health-wise, on a spiritual, emotional, and physical level. That's was my final point. So thanks, everyone, and nice to meet you all. Even if I didn't see your faces, I'll try and imagine that you're all enjoying it.
I will answer that. You're asking which vitamin. I don't think there's one specific vitamin, but when you look at, if we're talking specifically thyroid, and it doesn't have to be thyroid, there can be some other aspect further down the hormonal cascade. But if we're talking thyroid, the crux of the thyroid is the iodine that your body uses as a raw material, and then it builds that up with certain vitamin B, vitamin C, selenium, magnesium, and from that it will then produce the thyroid hormone. So you need to make sure that you've got those cofactors as well to help the thyroid to produce the thyroid hormone. That's answering that question. But like I said, there might be a bit further down the hormonal cascade, you might need other vitamins, vitamin B12, vitamin B6. So without a specific there, that's as much as I can answer you. If I can say this, iodine is very underrated, and there's almost a fear of too much iodine. And that's something that's called medico-iodophobia. It's something that has been developed by the medical fraternity. Actually, iodine is your friend. It needs to be used in the right manner. There is a huge shortage of iodine in our soils. They've taken I think it was in the 1970s, they used to add iodine to the flour. They changed that over, and they now add bromine to the flour, which is a halogen, which downregulates the thyroid gland. Doesn't make any sense whatsoever. And anybody who has any medical knowledge, okay, that is a travesty. And if you can, change the iodine to bromine, all I can say is, I'm sure you had some ulterior motive, because that is definitely destined to make a human sick. So we need to increase the amount of iodine that we're taking in these days. Problem with getting it from a dietary source such as kelp, and there's nothing wrong with kelp. It was kelp from the old days, but kelp is so intoxicated with, I think it is arsenic. So you can't get enough kelp in without being intoxicated with arsenic. So that's why you're going to use an iodine supplement in that regard. what you're saying is you're wanting some practical examples of how do I change this paradigm that I'm in, okay? I suppose I'm telling you to get brave. I'm telling you to do things that you wouldn't normally do, all right? So normally I'm not really in control of my health. I go to the doctor, he gives me the prescription, and I come back and I take the pills and I go to work, you know, that type of thing. I'm saying to you, change that. Start exploring who you are. Start seeing, you know, maybe even just read the back of the package. What is this medication? Oh, it's got all of those side effects. Do I really want that? Okay. What other options do I have? Okay. Maybe, and I don't want to be biased here. Don't go on to H247, go and see what the homeopaths offer. Go and see what extras you can add to your treatment. Maybe if I start exercising a little bit, or maybe if I do some proper breathing, or I change my diet. Start adding things to your life, okay? And start you taking responsibility for it. It's not always handing it out to the professional. And like I said, are you handing it out to a professional that is a professional in disease management, or are you handing it out to a professional who has got your best health interests at heart? There's a difference between disease and health. Am I looking at the glass half full or half empty? And by me saying that, I'm not saying that there's anything wrong with modern medicine. It's got its place, but its place is not in health. And if you're wanting to get healthy, that's where you've got to look at.
Now, neurotropins, there is the whole family of it. You know, few examples, there is brain-derived neurotropic factor, neurotropin 3, neurotropin 4, glia-derived neurotropic factor, ciliary neurotropic, and so on and so on. These are used by central and peripheral nervous system. And I think if we use it homeopathically, we basically trying to stimulate production by the nervous system, because if you look at Alzheimer, Parkinson's, or any of these neurodegenerative conditions, one of the things which happening there is production of neurotropins is less and less. And neurotropins are, for example, responsible for creating connection between nerve cells. They govern creating of synaptic connections. They govern creating of elongation of the axons, and so on and so on. So what we're trying to do is influence or restore production of neurotropic factors within nervous system. Now, in medical science, the guys know very well that this is a problem, but for pharmaceutical industry, it's quite difficult to do something with it, because neurotropic factors as molecules, they too big to cross brain-blood barrier. Therefore, it cannot be really, you know, cannot be made into a medication which cannot be taken orally. There were different tries, like transcerebral implants and so on, but this didn't produce much of results so far. So then you see, using those molecules as a homeopathic remedy, we're trying to basically do exactly the same like with any other remedy, similar, similar. We know that we're lacking this, we know there is a problem, so we use it as a homeopathic potency, trying to restore that, basically that production. And okay, I'm not sure, is this answering the question? Okay, and if I may, I have seen one more question there. There was something about how can somebody go straight into thyroid cancer? And this was questioned by Natalie. And I think Anthony and Chiara, they partially answered that question already, because I think, if I may add, there might be to it, I think you can get into, you know, when we spoke about that scale, you know, allergy, autoimmunity, cancer, and so on and so on, I think you don't necessarily have to go through all that stages. You can, okay, in some cases you will, but in some cases, you can go straight into, end of it. And what is needed, I think, is your predisposition. So then it might be that in a family history, the predominant way of is rather cancer than, for example, heart attack. So then it would be, part of it would be predisposition. And then I think I would say that another part would be strong enough trigger that, it sends you all the way to that state rather than going stage by stage. And then, again, I would say, relating to what Chiara said, thyroid gland is where the throat chakra is, and this is your communication, your expression, and so on and so on. I think it is, trauma big enough that will shut down the whole system without, any extra steps. You basically, somebody got blasted to the point that they skipped all the extra steps and they just went straight to the end of scale. That's what I think, and that's what I would suspect. Taking the case, I would rather say, I would expect big trauma there, and I would expect probably good family history of, cancer miasm quite active there. So that's more my bit to that question.
So why can't we give solutions to people on thyroid? Well, yes, we can give solutions. We can give you the remedies that are related to thyroid, but it's the application of that. And remember, there are different levels of disease, and there are different levels of, they call it the dynamic plane, where the disease can be focused on the physical or the emotional or the mental, or on all three. So if you give a remedy, you've got to be aware of where is the entry point to start to eliminate that illness or that problem or that emotional grief or anger or resentment. So if we're talking about solutions, we can put them down on a page, but how is the patient going to know which one to take? And this is why they talk about homeopathy being individualized treatment. And maybe it can frustrate people where it's like, I just want a remedy and then I'll be fine. It's not about that. If you can remember with Kira's explanation with her case there, okay? Now, that person probably wasn't aware that she had the rage or whatever the emotional trigger was, okay? Now, how is she going to choose the remedy? That's why you need to work with a practitioner who's trained to be able to pull these things out of you, or who's trained to be able to see, like, Bart was talking about the cancer patient there, to see the miasmic aspect. What do we need to give, and in what chronological order do we need to give the remedies? What potencies do we need to give the remedies? So we can put it down on paper, but it's going to just be gobbledygook for you. It has to be applied in a specific way.
And I think, sorry, go on, Karen, go on.
No, do you know, I'm a bit of a visual learner, I am. So as you were speaking there, the game whack-a-mole, when you whack-a-mole, when you're in a fun fair and you're trying to hammer down, things keep popping up. Well, this is my visualization of when somebody has an acute situation with a cough, a cold, a headache, or whatever, and they look up their homeopathic kit and they see, okay, I've got a fever, belladonna. Whoop! You give belladonna, the fever goes, and then 3 hours later it pops up again. Whack it down with belladonna, and then you're like, why isn't belladonna? Why isn't it staying? Why isn't it holding? And it's a bit like that with thyroid. There could be 5 or 6 very indicated remedies for your thyroid: iodum, arsenicum iodatum, napnior, calcarb, etc. And you might really read up on the remedy and go, that's me, that's what I need. And you take it, and then you might feel a little bit better, and then boom, 3 weeks later, it's back to square one, and you get disheartened. And as Anthony and Bart's probably going to add to, there are so many other factors, your health history in general, genetics, hereditary information that we need to take. You know, so yeah, does that help at all with the question?
Yeah, it does. It does. But you see, what I wanted to say now is, if you look at the homeopathic market, you're gonna see that there are a lot of combination products, and then this market is growing because you're gonna see a lot of combinations which are designed for specific conditions, which now, for example, going to be thyroid conditions. Now, what Anthony said, we know that what is mechanically needed by thyroid to work. We know that you need iodine, we know selenium, magnesium, iron, and so on and so on. Now, we know how the function of thyroid gland is mechanically controlled and how it is working, all the connections. So we can put all this in the combination. But then what and this is going to be ready recipe, hey, anybody with thyroid problem, take this product, you might be okay. But then I have seen this in practice. You will get only up to a certain extent, as much as those remedy can undo, but then you're going to hit a wall because you're going to get to the point when you have to face those deeper seated issues. And then you cannot, as homeopathy, and this is mass market homeopathy versus individualized homeopathy, because then having the same death in a family, okay, two different people will respond to this totally different. So then, as Anthony said, we don't really know what remedy that person will need. Then secondly, another thing, suppression and denial. These are quite synonymous things, that if somebody is in bad state of trauma, are they aware of it? They probably are aware of it, but they are in denial because they have to go to work, they have to earn some money, life has to go on, they've got a lot of commitment. So in this case, that suppression and / denial serves some kind of job because they have to function. So then the person, as Anthony said, will that person be aware of, hey, I actually have to address my deep resentment, or I have to address my shame? I don't think so. So then again, you know, you can have ready recipe up to a certain extent, but they will do, well, I wouldn't say superficial job. They will do some job. They will help you to manage okay, that would be a good word, to manage the condition, but this would be only managing the condition. And I'm going to point back to what Anthony was saying before, is about your expectations about how good you want to get, what you want to get with this, okay? Because look, another thing, you see, you have to, if you want to change this paradigm, you have to look slightly deeper into it, and you have to take slightly different action. But this action comes with responsibility, and responsibility is a very painful thing because it means going back in time and facing all that, you know, music from the past, all the traumas, and doing something with it. And you know what? It is probably the hardest, the most difficult thing everyone can ever do. And you see, another thing why those ready concoctions will do only, you know, partial job is because it is quite good number of research showing that people who been treated, will it be mainly about, you know, allopathic medicine, their slabs would be fine, but they still not fine, because we have managed to control, you know, hormonal aspect of the whole shebang, but we have left all the psychology and trauma and neurological aspect of it and immunology behind. So we only got a grip on one aspect, while the other ones are still out of sync. So, you know, that's why I think that there's no, it has to be one-to-one individualized approach rather than ready formula. That's what I think.
Absolutely, Bart. So I suppose there's also horses for courses, and maybe there can be a bit of ignorance in the part of the patient where they say, oh, I just want my say hypothyroid to be gone. Okay, so you give them that complex remedy and the palpitations stop, and they maybe put on a bit of weight, which they want, and they think, okay, great, I'm sorted. But they're not sorted. It's a palliative treatment. It's not getting to the root cause of the issue. And then a month later or a year later, something else pops up, like what Kira was saying with the belladonna story, where you got to whack it down, okay? So I suppose as homeopaths, you are taught to go for the kill. You're taught to go for the big fish, and you want to go and get that emotional trauma, or you want to get the root cause, the maintaining cause that's causing the problem. And it's often maybe a disconnect between the patient's understanding of health and what you're actually trying to achieve. I often see in my practice, I do a lot of educating, because a lot of people come from the medical model and they, oh, I've got a cough, just give me some cough mixture, or just give me a homeopathic cough mixture. Okay, that's an acute problem maybe, but you want to get to the root core issue of that, and that's where the disconnect comes. And so we need to impress upon the patients, and I feel that you need to have a patient under your care for a while for them to start to actually realize, to live the homeopathic experience. Okay, and now as I say that, there is a question here. If I'm not digressing, someone said that they were under homeopathic care for 3 years and so many few symptoms resolved, but the main one, the stubborn one, remained. This might be an example of that. Okay, they dealt with a few issues, but that root cause issue, it's a deep root, so it might take longer to resolve, or maybe the person is not in a place or a state to be able to release that currently. Like you were saying, Bart, they still have to go out, they're still stressed, that environment is not conducive to them releasing or pulling out that big root of the problem. So there's many factors involved when you're looking at, and use the word cure, right? So when I say cure out of my mouth and it gets to your ears, are you hearing the same thing that I'm saying? That's where there can be this disconnect.